Hello, my name is John Burris. Thank you for joining me today for this short video called The Pathology of Fascia. In this video, I'll be sharing with you a lot of elements from new anatomy, where we take the living body and basically enhance it and dive into a new way of seeing the world. You know, most of us, we wear down as we get old. Our knees hurt, our back hurts, our ankles hurt, our feet hurt, and we blame it on aging. Well, that isn't necessarily how it works. In most people's cases, their fascia has degenerated because they haven't taken care of it, because they haven't been taught to take care of it, because they haven't been taught that it's important. So today I'll be exploring with you the ways that fascia degenerates and it collapses, and ways to take care of your fascia better. So there's three main parts in our scientific examination of the world. There's anatomy, there's physiology, and there's pathology. Anatomy is, what are the parts? And so when I was growing up, I took 7th grade science and high school science anatomy and college anatomy and massage school anatomy and yoga training anatomy, and almost all of it's based on Western scientific musculoskeletal cellular anatomy, which is great. It's a great foundation, and I learned later on it's not all there is. There's Chinese anatomy and Hindu anatomy, like in the Ayurvedic practice, and then there's body-mind anatomy and emotional anatomy and energetic anatomy and all kinds of anatomies that are outside of the scientific cellular structure. So anatomy isn't just about cells and muscles and bones. There's a lot more to it. But in the first realm, anatomy basically is, what are the parts? Physiology is, how does it work? How does your gallbladder work? How does your intestines work? How does the joints work? What kind of joint is it? How does the body work? That would be physiology. Well, pathology is, what happens when it doesn't work? How does it break down? What are the things that could go wrong? And in today's video, I'll be sharing with you how your fascia goes wrong. And once again, most people have little knowledge of it. Medical doctors know almost nothing about it, so they can't teach you. And I've learned over the years by my many yoga courses that I've taken and massage trainings and college level anatomies, you're not going to get a great understanding of pathology in an anatomy book, because pathology is really hands-on. For all the thousands of clients I've worked on and the thousands of yoga classes I've taught, you start to see the breakdown of the body. And it's not clearly defined, and I'll talk about that later, in anatomy books, because they don't tell you what goes wrong. They just tell you what the parts are. So today I'm going to give you an in-depth analysis of what can go wrong. And many people, they know it in their body, they feel it, they just don't have a word for it, a name for it. No one can diagnose their condition. Well, I'll share with you ideas today. They go, oh, that's why I feel that way. That's why that part feels tight when I move this way. So pathology is all the ways that our fascia could go wrong, and we'll be sharing with you today and giving you some deeper insights about how to take care of your body in a better way. So let's start about what is fascia to begin with. So fascia is like the white stuff in an orange. It's the white fibers that contain the orange juice. And if you were to squeeze the orange and let all the juice come out, you'd have a bunch of white fibers left. Well, that's about what the fascia is in the body. It contains everything. It's like the human scaffolding that goes everywhere in the body, and it contains everything, and it holds you upright. So once again, fascia is like the white stuff in orange. It goes everywhere, and the medical world just cuts it out and throws it away. It's considered waste material in the medical world. So the problem is there's very little respect for it. In the living anatomy world, which I live in, the bodywork world, the massage therapy world, and the yoga world, it's really important. And we respect it. We show you how it's all connected and how one part leads to another part. And it shows you the dynamic nature of fascia and why it's so important in the body. And if you can't understand, you have a tissue in your body, how can you take care of it? So most people, once again, I believe are ignorant of their fascia. They're not taking care of it correctly, so they have all kinds of problems. Also, fascia doesn't necessarily show up as a problem on an x-ray. You know, it doesn't show up like a broken bone does. It just shows dense material. And unless you're actually touching fascia, you can't necessarily diagnose it from many of the scientific instruments. So you'll go into a doctor's office and get an x-ray or a CAT scan and your fascia looks healthy, but when your massage therapist touches you, go, wow, what's going on here? So it's really the touch concept. When you touch hard tissue, it's different, and it won't necessarily show up on an x-ray or a CAT scan. But what you do notice is, like, every time you walk, you feel a pull in your groin, and you're diagnosed with some strained muscle or whatnot, but in most cases, the medical world doesn't diagnose you as having a rotated leg or an old sprained ankle that's causing a spiral in your leg. They just think you have a strained muscle in your groin. So you know it, you feel it, but in many cases you're going to be misdiagnosed and mistreated because the medical community doesn't understand the broad nature of fascia and how it's related, and their devices to measure it will give you almost no information. So now I'm going to go into 11 different ways that the pathology of fascia will degenerate in the body, and these are brand new ideas, so they might be new to you, but listen carefully and it'll give you a new hope that maybe you can too feel better in your body if you understand what's going on. So let's start with the first one. The first one's called spirals. Spirals in the body are the first way that the pathology of fascia goes wrong. So we need to understand how that actually happens. The first point to recognize is a wonderful work by Thomas Myers. It's called Anatomy Trains. And he shares with you the anatomy of the fascia lines in the body. He calls them railroad tracks, train tracks that travel through the body. So this is anatomy. Now I'm going to show you how anatomy and pathology aren't necessarily the same thing. Here are 3 different pictures from Thomas Myers' book, Anatomy Trains, and I love his work. And today I'm going to add things to that. So this is the front line of the body, the side line of the body, and the back line of the body. And this is the way the fascia runs through the body in a line of connective tissue. And it's all connected through these lines. And here's where I want to add to Thomas Myers' work. So here's my understanding of pathology. The lines of hurt in the body and damage aren't always in a straight line. And this shows a classic example of how many of his fascia lines become glued together and they work as one unit rather than 3 or 4 different individual lines. So this is pathology. For example, if you look at the bottom of the foot, somebody has an old ankle sprain and it never gets corrected and taken care of. And over time it hardens and it dries out. And what it does is it causes the lower leg, the shin, to rotate outward. And then the body will attempt to compensate. As it crosses the knee joint, it starts to pull inward and it causes the hamstring, the groin, and the psoas muscle to shorten. And then as it crosses the hip joint, it rolls out into the lower back and hip. And this could be a classic way most people have sciatica. It's not a straight line. You have 3 different lines of different fascia tissue that are glued together that work independently. So this is pathology. So anatomy isn't always what you think it is, because when you talk about pathology, now you have different tissues that are affected that don't look the same in an anatomy book. So this is an important point to remember. Anatomy and pathology are different. They don't look the same. So anatomy is what you find on a cadaver, dead tissue. Pathology is actually a living person, how somebody experiences your body. So as I just showed you the picture, the pathology corkscrew in the leg affects 3 or 4 different lines of fascia, and they glue them all together. They fuse together. And this, what I talked about, is a classic sciatica problem. It's not a straight line up the leg. It's a corkscrew that affects different anatomical structures and fuses them all together. The second aspect of the pathology of fascia is the crisscross glued lines together. Everything is glued together. So the model I like to use for the crisscross glued lines is this. You have these lines of fascia traveling through the body in all different directions. And they cross over at different depths all the time. And they will fuse together if you're living life incorrectly and you're fusing yourself together. And all these lines will fuse together, and when you're born, they're separate. When you're born, the first few years of life, they're separate. And because of how we live our life, these layers glue together. This is especially important. It happens between your shoulder blades. It happens in your groin, happens in your armpits. You know, your armpits aren't supposed to be glued together. but they're supposed to be working independently, the tissues. But when your fascia, because of the lifestyle and injuries that go uncorrected, starts to fuse together, and these crisscross patterns are now one big blob of tissue. That's not supposed to happen. That's the pathology of the crisscross pattern. The next pathology of fascia issue is the splatter effect. And I'm borrowing this term from Dr. Robert Marshall, who I first heard it from. So here's how the splatter effect works. Imagine you're playing baseball in college, and somebody throws an errant fastball at you, and it hits you in the upper shoulder and chest. The energy spreads out, and it's a splattering. It's much like a paintball spreading out. And unless you take care of that correctly, you're going to have a splatter of energy affecting your tissues, and it causes the fascia to harden in an errant pattern. And it's like a paintball spreading out. Another way I like to look at it, imagine you're on your bicycle and you fall off and you roll onto your shoulder. Well, there's these lines of tension that go everywhere else. A year later you go, why does my rib cage hurt way down here? Why am I having neck problems way up here? Because these tentacles from the injury have spread across your body, and it's like splattering the energy, and so you're going to have weird sensations in many different locations because the fascia hardens into a splattering effect. Let me show you some better pictures here. Here's a picture of somebody who was in a car accident many years ago, and the energy splattered and it affected all kinds of the parts of their body. This doesn't go away because as the fascia hardens, the energy is still there in place, and the fascia will harden in that position. You're not going to get a medical diagnosis. You're going to feel it every day going, why is my back and hip and knee all connected in a kind of a strange pattern that it hurts to walk? Because the energy of the splatter has affected the fascia in this pattern. And here's a person who fell off their bicycle onto their shoulder. So where's the shoulder? It starts in the mid-back, goes in the neck. In this splatter pattern, you're going to feel the entire side of your body affected, from the arm, neck, mid-back, lower back, because the energy of the accident has splattered into your fascia, causing hard, rubbery, dried out tissues for the rest of your life unless you decide to take care of it. The fourth way the fascia is intruded on is called energy cyst. So an energy cyst is an incursion of trauma into the fascia tissue, and it eventually over time will erode the fascia itself. So for example, you fall up 15 feet off a ladder and land on your shoulder here. So the energy of impact gets implanted into your fascia. It doesn't go away. It's like you take a sledgehammer and hit a wall, and that hole never goes away. So the energy impact never goes away, and it creates a deterioration of your fascia tissue over time. And so that's called an energy cyst. And here's where it's really interesting. In my work as a body worker with people with multiple sclerosis, it's the same thing. So here is our nerve issue here. So this is the nerve. The yellow part here is the myelin sheath that surrounds the nerve. It's a cushioning, and that's made up of fats and proteins. Well, guess what? Outside the myelin sheath, there's 3 layers of fascia tissue. And what we know about fascia changes shape and it has energy components to it. So what I find when I work with multiple sclerosis patients, which means it's basically an erosion of this whole thing. What's really eroded is the fascia. And usually because there's an old injury stuck in the fascia tissue from like when you're young. And that energy cyst causes the erosion of the fascia tissue, which is the outside of the nerve. And then you start eroding the myelin sheath and the nerve itself, then you start having all kinds of physical challenges. When I work with multiple sclerosis patients, it's always about repairing the fascia and removing the energy cyst that's around the nerve. And that way the nerve goes back to where it's supposed to be, because the real source, in my opinion, of multiple sclerosis is in the energy stuck in the fascia around the nerve. So energy cysts are another way that the fascia has problems. The fifth element of the pathology of fascia is called hydrogen bonding, when everything starts to glue together. So this is what happens to most people. So this is your tissue here. The blue fibers here, those are the myofibrils. These are the muscle fibers. When you're lifting weights and training and doing fitness and playing sports, you're trying to build more myofibrils or to expand the one you have. Here's where the problem lies. All that muscle fibers are surrounded by fascia tissue. When you're younger, it's basically a grape. Most people die as a raisin, they dry out. So if all you do is muscle train, sport, fitness, running, lifting weights, and you don't stretch or do expansive movement to counteract that, this liquid, it's basically liquid, starts to dry out. So you end up looking like this. It's called hydrogen bonding. You turn to stone because you're building muscle fibers and your fascia tissue turns to stone. So it's not just fitness people, it's people who are under a lot of stress, old injuries that aren't taken care of. It's a lifestyle of basically if you have a manual labor job and you're working, climbing trees and jackhammers every day, your tissues, you look strong, but you age quickly because you're gluing together and you're shrinking. This is what happens to most people who are either not doing anything or doing the wrong kinds of movements. So the fitness world is full of hydrogen bonding people because they're gluing themselves together and hardening their tissues because they're too concerned with building muscle fibers without the proper stretching of the fascia tissue outside. So hydrogen bonding is one of the ways that pathology of fascia degenerates. So here's what layered intrusion is. So once again, imagine there's a trauma. You fall on your shoulder, you get hit by a baseball pitch, something hits you, and you're here. Well, that injury doesn't lie on the surface. The body is a series of layers and tubes, and we don't recognize that. So what I look at like the body is, here's a paper towel. It's many, many layers, many layers. It's not just one or two, it's many, many layers. We're a tube wrapped around, much like a tree ring. Rings and rings of layers. So if this is your shoulder here, that injury doesn't just stay there. So the way I look at this is this. So I'm going to pour a little cherry juice here and show you what happens. As we start to, this injury starts to penetrate into the body. And it starts to go deeper and deeper and deeper. And eventually it gets to the bottom line and core. And eventually it doesn't just go through one layer. So now we have an intrusion going deeper and deeper into the body. So the injury doesn't sit on the surface. It goes deeper and deeper and deeper into the body. So as a body worker, I can often tell how deep somebody's injury is, and it tells me how old the injury is, how long it's been there. Many people cover up their injuries with tight muscle, hard muscle, gym workouts, and they put a layer on top of this. But their injury is actually buried deep inside. It goes multiple layers deep. It doesn't just sit on the surface. So the pathology of fascia is these layers start to glue together. Also, a movement therapist, somebody who's really in tune with movement, a dancer, somebody who's doing a lot of yoga, somebody who's doing a lot of functional movement, they will know where they're at. So for example, when I did intense yoga, I knew which layer I was at, where my injuries were. I go, okay, I'm at that layer now. I'm right there. I'm working from that layer there. So if you're really in tune with your body, you can tell where your resistance is and what your layers are. Most people build tight muscles and they basically desensitize themselves. So they get hard and tight and they lose their ability to feel where they are. It's like a suit of armor. The more you practice unwinding movement, body work, yoga, other types of movement, the more you can tell where your injuries are because the injury doesn't sit on the surface. It goes deep inside. And when I do body work with people, we have to go dig deep and dig deep to start to find it. So the work that I do, that I've created, isn't just take your elbow and go, let's just go through here in one time. I find that very ineffective. So the work that I do, you have to peel away the layer like the tree rings until you can unwind the tissue itself, because the wound may be deeper and layered deeper, and all those layers are fused together. So you have to unfuse those layers because that's where the trauma lives. The seventh way that the pathology of fascia creates disruption in the body is interference fields, and this is something I learned from Dr. Robert Marshall. Now, interference fields are very similar to energy cysts. There's a little difference that I notice is this. Interference fields can be caused by lots of different reasons. Sometimes toxic substances cause interference fields, causing the fascia to be disrupted and damaged. So in my experience, here's what I know to be true. So I had a client once who he was a doctor, medical doctor, a surgeon. He got a flu shot in his arm. Next day, he couldn't lift his arm. For 3 months, 6 months, a year, he couldn't lift his arm. For 2 years, he couldn't lift his arm. The poisons, the toxins in the vaccine cause fascia disruption and cause immobility. My own experience, when I was about 8 years old, I went for a tetanus shot in my arm. And I was playing baseball, and I couldn't lift the arm after that. And for the next 20 years, I could barely lift my arm because that one tetanus shot had caused an interference field in my shoulder. So I find this a lot with people who have shoulder issues. Frozen shoulder, for example. The injection from the vaccine, whatever is in that particular vaccine, often causes an interference field where people have disruptions in their fascia tissue, and it causes what often leads to frozen shoulder. The next way that fascia is damaged is from toxic substances being held in the body. Now, the body and the fascia are a river of flow, and when you have a poor diet, when you ingest things that your body doesn't like, your fascia holds on to it. For example, if you eat the standard American diet of processed foods and junk foods and all kinds of preservatives and whatnot, your fascia holds on to that, and it starts to basically build up. If you have a drug diet, basically, if you take a lot of drugs, not just prescription drugs, but over the marijuana, for example, if you smoke nicotine, alcohol, it stays in your fascia. I have had many experiences as a fascia body worker where I'm working on somebody, and all of a sudden I get squirted by alcohol or nicotine shooting out from their fascia. So your fascia becomes toxic if your diet or lifestyle are toxic, and that is adding to the degeneration of your whole body as well. Your fascia can be part of the immune system response, and when it's not healthy, your immune system isn't healthy as well. Essentially, your fascia is liquid gelatin. And we are all born like a grape, and most people die as a raisins. We dry out because of our lifestyle choices. So think about your fascia as a bag of water. And in that bag of water, there's cells. For example, it has elastin, which are called yellow fibers, create stretchiness. There's also collagen, which creates a strength to it, so it's strong and stretchy. It also has all these other cells in it as well. All these other cells like macrophages, and it has lymphocytes, and all these cells in here, and those gobble up viruses and bacteria and cancers. The problem is most people dry out as they age. Their fascia becomes dry and sticky like beef jerky, and it loses its ability to work for your immune system because it's dried out. So all those healthy cells that are helping your immune system are now dried out and ineffective. So the secret to life is to keep your fascia healthy and liquid. When it starts to dry out, you start to lose your immune response, and that's part of why people get sick more often. Number 10 is bone health is reliant on the health of your fascia. In order to have healthy bones, you need healthy fascia. They work together. For example, the layer of fascia around the bone is called the periosteum. There's a layer of fascia inside the bone called the endosteum, and they're connected by holes to the bone. They talk to each other. So muscle does not attach the bone. It's the fascia that attaches the bone, and then that fascia will continue on to create a muscle tissue. Many of the nutrients that the bones need travel through the fascia. So if your fascia is dried out and brittle, you lose the ability for nutrients, including osteoblasts, which build bone, to get to the bone. So you have weaker bones because your fascia that surrounds the bones is weaker. So a lot of people's bone issues have to do with the weakened, dried out fascia that surrounds their bones. So that doesn't have to happen. If you were to keep your fascia healthy and liquid, you would have less problems with your bones because they work together. So bones and fascia work together, and you need healthy fascia to have healthy bones. And the last part here is fascia and its relationship to burns and scars. I would often ask myself, why is it that you fall down and you get a bruise in your arm or shoulder, and a few days or weeks later it's gone? Because we have trillions of cells, and every day new cells are brought in, and old dead cells are taken away, and that bruise goes away. Well, why don't burns and scars go away? And what I discovered was this, that fascia holds memory. And a burn doesn't go away, a scar doesn't necessarily go away by itself because the memory is still active. And what happens, for example, in a burn, when you're burned, the body's wisdom says, oh, there's a hole in the body, we need to plug it up. So it sends essentially collagen to fill the gap. And every day, it brings more collagen there, even though it might have been years or decades earlier where you had the burn, because the memory is still there and the body still believes it's on fire. So what I do in my work is I use my hands and I start to remove the memory. And when you remove the memory, the body says, oh, there's no longer a hole there. I don't have to plug that up anymore. And it creates healthy cells rather than collagen cells. And that's how the memories are held in the fascia tissue as well. So when you take away the memories held there of the trauma, new healthy cells come in to replace the old dead cells. So that's essentially it. That's the pathology of fascia. That's what happens to most of our fascia. That's how people age. That's how trauma gets held in the body. These are things that aren't necessarily going to be diagnosed in an emergency room or a medical doctor's office. So these are things, part of the new anatomy. You'll find this in living anatomy at yoga studios and bodywork clinics and massage schools, as we learn the body is not just about muscles and bones. So there's a whole exciting future ahead of us. So here's my suggestions for you. This is what I've done over the last 35 years. Start to study fascia. Read as many books as you can. Watch videos. Start to educate yourself on the importance of fascia. It's one of the most neglected tissues in the body, and we've neglected it. Dynamic health means dynamic fascia tissue. Also, regular movement, not the wrong kind of movement. Most people are moving incorrectly. Your golf game isn't going to correct your fascia. Your pickleball match isn't going to correct your fascia. It's got to be expansive movement regularly. I highly recommend yoga because yoga stretches your tissues, lengthens your body, it opens things up and keeps things warm and liquid. Other types of expansive movement are really important too. Functional movement, not just contractive, hardening, tightening gym workouts. Those are going to make your fascia harder, tighter, and drier. Lots of massage and body work. Regular Swedish massage is important. It's not going to be directed so much at your fascia. It's more about your circulation and your relaxation. Also, a fascia body worker where you're focusing directly on the fascia is very helpful, as you can start to manipulate and change the fascia and turn hard stone-like fascia back into a liquid nature again. You can reverse this, but you're going to have to turn around a new direction. You can change those weary bones that are degenerating, because if you make the fascia healthy again, it gets nutrients. You can change your posture. You can change your immunity by making your fascia important. These are all things that I've done. So thank you for watching this video today. I hope you feel a little bit more informed. This is all leading edge information. If you'd like to be part of the leading edge community, you can subscribe to this channel for more leading edge videos to come. I have a great book called Return to Nature, the 5 Pillars of Healing. You can pick that up at my website, johnburris.com, barnesandnoble.com, or amazon.com. Thank you for joining me. Have a great journey.